AED, child-infant. An automated external defibrillator, or AED, is used when a person's heart stops beating or is beating ineffectively during cardiac arrest. AEDs can be used on adults, children, and infants. These powerful cardiac resuscitation tools are becoming common anywhere people gather. They can be found in places like airports, malls, schools, and churches. But it's important to remember that if an AED isn't immediately available, you should start CPR right away. Let's take a look at how to use an AED with a single rescuer. After assessing the child and performing 2 minutes of CPR, which is about 5 cycles, our rescuer calls 911
I have an unconscious child
and gets an AED. Next, she places the AED next to the child's shoulder, turns it on, and follows the prompts.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
If the chest is damp, she will dry it. She'll also move any metal that could come in contact with the pads.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
Some AED units have pads that are intended for use on children. If they're not available, use the adult pads.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient. Analyzing.
She is careful not to touch the child while the AED is analyzing the heart. She must be certain that no one is touching the child.
Shock advised. Stay clear of patient.
Everybody clear!
Some AEDs deliver the shock automatically. Some require a button to be pushed.
Press the flashing orange button now. Shock delivered.
After the shock, she immediately
1,
gives
2,
CPR
3,
for 5
4,
cycles.
5,
Each
6,
cycle is
7,
30 chest
8,
compressions
9.
and 2 breaths. Now it's your turn to practice.